So, let's talk about some things. Is this your child? Some of the common signs and symptoms of anxiety. Number one, feelings of panic, fear, and uneasiness. Again, not all of these are cut in stone for every person. Some might have some of these, some might have others. Some people's anxieties might manifest completely differently than others, even though it's the same thing going on in the brain. So feelings of panic, fear, and uneasiness. Problems sleeping, insomnia type of symptoms, difficulty going to sleep, not wanting to go to sleep, difficulty staying asleep, getting restful sleep, waking up, every hour on the hour at night. Those kind of things can be symptoms of anxiety problem as well. Cold and sweaty hands or feet, clamminess, inability to sit still and to be calm. Remember my son, that was a big problem for him. They thought it was ADHD, but it was anxiety. When we figured out it was anxiety for him and started treating him that way, treating the problem in that way that we can treat anxiety with, then we saw the changes in him. Then we saw the real reduction of his symptoms once we understood that. Isolation and fear of social situations, activity avoidance. A lot of times it leads to isolation. They don't want to go out. They don't want to go to school. They don't want to go to church. They don't want to go to family things. Sometimes social situations ramp up their anxiety to the point of creating, an uncomfortable atmosphere, to the point of increasing their anxiety excessively, to make it uncomfortable, to make it difficult, even inducing panic attacks and other things like that. We need to remember that anxiety, the symptoms of anxiety, they're normal. Those are normal symptoms. We're supposed to experience those sometimes in our lives. The problem with anxiety as a diagnosis is that when these symptoms become excessive or uncontrollable or inappropriate. Sometimes it's okay to feel a little bit anxious in social situations. We've all felt that before. But when it's our family, that might be at an inappropriate time. Or when it's excessive at church or school, that might be inappropriate as well. And so that's where we get into diagnoses of anxiety. Some more common signs. Cold sweats, we mentioned that. Clamminess in the hands and the feet. Panic attacks, right-out panic attacks. Shortness of breath, where you can't catch your breath, you can't breathe. It feels like you can't breathe. Depression is associated with anxiety, and they can be so closely tied together. This is one of the big things. I'll mention this a little bit later as well. This is one of the big things that I see commonly occurring with anxiety. We call that comorbidity. I'll mention that again in just a little bit. But especially with teenagers who are experiencing anxiety, I see a lot of depression at the same time. A lot of times there's a common link between the two, neurologically. And as we treat one, as we try to change the brain to working better to treat one, a lot of times we see the reduction in the symptoms of the other. We see a reduction in the depression as we treat the anxiety, and vice versa. Sometimes depression and anxiety are kind of a chicken and egg kind of situation. One of them comes on first and it leads to the other, and vice versa. So we see depression a lot with these kind of things. Again, loss of control, unfocused, unproductive. Again, more of the ADHD kinds of symptoms, kind of situations there. One of the big things a lot of the patients tell me that they feel is that they feel like a prisoner of the disorder. They feel like that they're stuck, that they're caught, that they can't move forward, that they're just trapped because of this problem. They can't go outside. They can't go to the store. They can't go to school. They're trapped. They want to be free. And when they put it into that perspective as parents, it becomes a little more obvious. It becomes a little bit more, we become a little bit more aware of what the person, what our son or daughter is going through with this anxiety. It's hard to wear anxiety on your sleeve. It's hard to look at someone and say, well, they're an anxious person. You can't really do that. We can hide anxiety pretty well. But the things that are going on inside of them, the things that they're feeling, what they're experiencing, we can't really understand it unless we've gone through it ourselves. If we understand better that they feel trapped, that they feel like this prisoner situation, we get a little bit better of an understanding of what they're going through. hopefully we can give them a little bit more empathy, at least sympathy, in what they're going through.